So next we have Chapter 4, which focuses in on health and the global environment. Some of the chapter highlights for Chapter 4 are defining the definitions, defining the global health and the global burden of disease, identifying and listing the indicators of health and human rights, identifying and reviewing the factors that affect health globally, identifying and reviewing the framework for improving world health, and then outlining the Millennium Development Goals. What are the strategies that we have for the next 1,000 years? So first of all, we want to start with the definition of health. Health is a state of complete physical, mental, and social well-being, not just merely the absence of disease or infirmity. So the next is the definition of global health. The global health encompasses the behavioral and environmental risk factors of a community, which are influenced by politics, economics, and culture. The determinants of health are the factors that that influence health outcomes. So in order for us to understand the scope of the definition of global health, we need to understand what are the determinants of health. So what impacts them? The factors are physical environment, social environment, health behaviors, as well as individual health. Address the broader factors such as access to the health services and overall health policies and their interventions. In many countries of the world, we need to consider the shifts in demographics. Some of those shifts are impacted by higher fertility and higher mortality, which results in slow population growth. We have improvements in health, hygiene, and nutrition, which leads to a decreased burden of infectious diseases, a decline in mortality, and later a decline in fertility, and increase in relative proportion of the elderly population. All of these transitions and aspects that are happening around the world will have an impact on health. To investigate the global burden of disease a little bit more, global burden of disease are the risks to health and health outcomes in different demographic populations and social settings. The burden of disease is growing disproportionately in the world and is largely affected by climate, public policy, the age of the population, so increased in the elderly, and socioeconomic conditions and risk factors. Thinking of the political shifts in the world, all of those have an impact on the health outcomes of individuals. The civil wars that are happening, the refugees, the shifts of people that are moving from country to country, and the unstable political environment all have an impact on the global health. So additionally, to hone in a little bit more, what are the risk factors that affect the disease burden? So risk factors can be defined as personal habits and behaviors, environmental conditions, or inborn or inherited characteristics that are known to affect health-related conditions. Certainly, environmental impacts of just having clean water is something that is in many of the countries a struggle. Having food is a struggle for many of our many people in countries around the world. Childhood and maternal malnutrition and other nutritional effects that related to risk factors and inactivity. You know, we do have a problem with obesity in the United States. We have malnutrition in other areas. You know, just going to the supermarket, you take a look at the wide variety of foods that are available to us. in our country and other developed countries. Um, the variety of food, having fresh fruits and vegetables available all year round. Many other countries don't have that, and unfortunately, it's pretty sad when we take a look at the levels of malnutrition in some of our countries compared to the threat of obesity within our country. Addictive substances add to the burden of disease, sexual and reproductive health, and other environmental risks. On top of the fact that other risks that affect global health at a higher level is the political, the economic, and the socio-demographic aspects. Again, I point to the example of the shifting of the populations based on the civil wars that are happening in the Middle East and in many countries of Africa, and as a globe, what are we going to do with those things? So part of what the World Health Organization has done is to develop the Millennium Development Goals. I mean, these are pretty lofty goals, but to eradicate extreme poverty and hunger, to achieve universal primary education. So in order for people to have an impact on their lives and their health outcomes, they need to have some primary education. We want to make sure that we promote gender equality and to empower women, women being in most societies, women are the group that directs much of the health, delivers the health care, as well as directs all of the aspects that impact health outcomes for others. To reduce child mortality, as you saw with the earlier chapter of the mortality and morbidity rates of many areas of the country, of the world. We want to improve maternal health. We want development goals to impact the HIV and AIDS status, malaria, and other diseases. Try to ensure environmental sustainability. An older example would be the burning of the forests in South America, as you've seen outlined in your text, so that they can plant crops, although that makes the whole environment unstable. The ability to absorb carbon dioxide and create oxygen has an impact on our overall carbon footprint. To develop a global partnership in development. A lot of the discussion at the recent talks have been on as far as global health and the global climate and how we could try to get control of some of the development so that its development is not does not negatively impact the health of the people that are living in those particular areas. Along with specific health outcomes is that we need to make sure that we have the effective workforce to deliver and to support these health outcomes. So making sure that we have increased investment in education and training for these individuals. Oftentimes in many places in the world, again, these are women that are developing and implementing the healthcare, supporting healthcare, making sure that we have a national health workforce plan. Even within the United States, we have quite a few issues regarding our health workforce. Protection and fair treatment of health workers. Again, that's perhaps more important in some of the other areas of the world, and HIV is still a very large issue. Additionally, we want to attract women to professions and addressing retirement as far as looking at the statistics with the nursing workforce within the United States. There's a big issue with those of us that are baby boomers, and making sure that we have enough nurses available to help us to deliver on our promises and our goals within public health. Making sure that we have the right incentives to attract health workers to rural and disadvantaged areas. And then finally, to promote health and focus in on prevention strategies to hopefully reduce the demand for health services. So again, sort of thinking of the example that I used in an earlier chapter about project management, you have these certain aspects, making sure that that the demand, supply and demand of whether it is the workforce or the needs for healthcare workers, by making those adjustments, hopefully we will bring some of these things back into balance.